Well, joining me now is the administrator of the Centers for Medicare and Medicaid Services, Dr. Mehmet Oz. Dr. Oz, thank you so much for joining me. Really appreciate it.
Honored to be with you, Kristen. Thank you for having me.
Well, it's wonderful to have you here, Dr. Oz. I want to start off by asking you about open enrollment for the Obamacare marketplace, these subsidies. Open enrollment, of course, begins November 1st. It's already underway for Medicare recipients. I want to ask you, if the ACA subsidies expire, premiums for everyone could more than double. Do you believe those subsidies should be extended?
You know, the reality is the ACA has been sick from the moment it was created, and it got a lot sicker during COVID. There were changes made, like these enhanced subsidies you're asking about. They were added on top of the already robust subsidies that exist. Probably 92% of the money that's spent on insurance premiums are part of the original ACA, and that wasn't even enough, apparently, because they added more money during COVID. So the question really isn't, should we put more money into it, or how much more, or continue these COVID-era subsidies? Is how do we actually restructure the system, Kristen, so it works? And to do that, you need smart people like the kinds of folks we have in this beautiful building I'm speaking to you from, which houses HHS and the agency I run, Medicare and Medicaid. But they're not here now. They're furloughed. They're at home. So all the actuarials, the insurance experts, all the folks who have spent their whole life studying how to provide better quality insurance to folks from the bottom end of the income spectrum, those making, 100 to 400% of the poverty level, those folks aren't here. And my first time through government is, I was sitting where you were for most of my adult life, trying to actually be in the private sector. But I never really thought that the shutdown would last this long. I always assumed that the Democrats had made their point. They were upset about the one big beautiful bill. ACA came into the conversation as well, and they would sort of get everyone back to work so they come up with some serious answers. But it takes time to come up with major policy steps. But can I add one thing, Kristen, because you asked the question?
Yeah, please.
The issues here, we're obviously in open enrollment for Medicare, and just for everybody out there, for the seniors, don't be alarmed. Medicare itself, everyone loves it. Democrats, Republicans, no one's touching Medicare. So Medicare.gov is open, and if you need to go through open enrollment and take an extra fresh look, please do that. But the accusation that the one big beautiful bill also needed to be repealed sort of surprises me, because we know that it cut out a lot of fraud, waste, and abuse, and especially when it gets to specific issues like claims that there are no illegal immigrants getting money through the system, so why would you bother picking on that? We went back and checked, Kristen, which is my job. I had investigators actually look at the numbers, and just this week we learned that there's more than $1 billion spent on illegal immigrants just over the past few months in just half a dozen states on illegal immigrant health care, which means if you live in Texas, your federal taxes are being used to pay for illegal immigrants in California. And that's not how the system should work. So parts of the puzzle don't make sense to me.
Dr. Oz, a couple of follow-up questions for you. First of all, we should note undocumented immigrants are ineligible for federal health care programs. But let me just ask you, you cite this new study. Are you going to release the findings? We have not seen this actual investigation and the results that you're citing. Do you commit to making them public?
I do, Kristen. I commit to you right here and now we'll make that data public. The reason it's not public now is it's so new. We began collecting data from the first 2 or 3 states 6 months ago. We got another 3 or 4 states on. We're going to look at a total of 8 states which have state-based mechanisms of paying for illegal immigrants. As to your point, by the way, and you're right, federal money is not supposed to go towards illegal immigrants. However, when states have a desire that they make on their own to fund illegal immigrants, they often commingle those monies, and that's the money we're talking about now. They may not have done it on purpose, but you should know, Kristen, they're already returning hundreds of millions of dollars. So you don't return money that you don't think you owe.
All right, Doctor, I was just getting back to my original question, though, about these subsidies, and we'll debate health care in just a moment, but do you think they should be extended so that millions of Americans don't lose their health care coverage?
I wouldn't extend the subsidies the way they were created for COVID. Remember, we were at war with a virus. And during wartime, you take extreme steps to try to make sure everyone's protected. And, I think at the time when this decision was made, fine, everyone acknowledged that eventually we'd be past the COVID era, which we are now. We're no longer at war. And so we don't want to use the exact same tactics that we used to deal with a virus when we're out of that period. If we want to have a serious improvement of the ACA, which I think, again, because it provides insurance to those folks just getting off Medicaid before they enter commercial insurance, then we ought to address it more more robustly. I'll give you a concrete example, Kristen. When the original models were created for the ACA, it was always believed that half of the people in the exchange would come out of the private sector and be funded from the private sector. The other half would come with government subsidies. It's 95% government subsidized because so much of the subsidy goes into the insurance companies that they don't need to compete on price.
But Dr. Oz, I hear you saying that you think Obamacare is deeply flawed. So let me ask you, Republicans control the White House, the House, and the Senate. You've had control for 9 months now. If Obamacare is so bad, why hasn't the president introduced an alternative plan yet? He's had 9 months.
Well, there were ideas introduced to address some of the shortcomings of the ACA, but it could not get through the reconciliation process. It was pulled out for a variety of different reasons, and so it never made it to the final law. And the legislation that currently exists does an excellent job dealing with the shortcomings that we felt were important with the Medicaid systems. And it was always envisioned that Congress would eventually get around to dealing with some of the issues that you're raising now around the ACA. But when you're in a shutdown, you prevent that from actually happening because the people who give technical expertise to the congressmen and senators who've got to actually write the laws, they're not at work anymore.
Yeah, but Dr. Oz, Republican Congresswoman Marjorie Taylor Greene has sharply criticized Republicans, saying that there is no health care plan. She says that it's time to get one. Do you acknowledge that President Trump does not have a comprehensive health care plan with which to replace Obamacare?
I fully believe the president has a plan. We've been talking about it quite a bit. There's all kinds of ideas. Yes, the issue, Kristen, is which specific parts of the plan do you prioritize? Which are the ones you want to focus on? So as an example, just to talk about Medicaid, because we already did it, what was done with the One Big Beautiful Bill was perhaps the most ambitious reform of our Medicaid system ever. It was a massive effort to realign the president and the leaders of states, governors, so that what the federal government wants to do and what the state government wants to do for our most vulnerable citizens are done in coordination. The president did that with a great passion. He led the way. I spoke to him frequently during that process. We also took out a lot of the fraud and waste and abuse, so it was hurting the system. Kristen, we would have spent $5.4 trillion more on Medicaid if we hadn't addressed that. That would have basically made us a big healthcare system with a small country attached.
But Dr. Oz, you're saying President Trump has a plan. If he has a plan, why hasn't he put it forward yet? Why don't the American people know about it yet?
The plans that were originally offered during the One Big Beautiful Bill negotiations fell out, which is fine. But when you hold the entire country hostage by shutting the government down, which is what the Democrats have done, you don't allow any discussion. There's not going to be any coordinated effort. You're not going to get one party to compromise with the other party when you're literally holding the entire government hostage. And the folks who would help this system evolve into a mature model aren't at work to help do it. I think we should reopen the government. We should use a clean CR, continuing resolution, to do just that. It needs to be long enough to give everyone time to both evaluate and come up with other ideas. But in the meantime, let people go back to work. Free the federal employees to go help the system and do their job.
All right. And just to button it up, so far, the president has not officially put a bill on the floor. I do want to ask you, though, the president has talked about lowering drug prices, pharmaceutical prices, and he's repeatedly claimed that he could cut those prices by more than 100%. Dr. Oz, take a listen.
We've cut drug prices by 1,200, 1,300, 1,400, 1,500%. I don't mean 50%. I mean 1,400, 1,500%, because we're going favored nations.
We have something coming up, favored nations, where I'm going to be reducing drug prices by 1,400, 1,500%. Drug prices are coming down 400%, 200%, 600%, numbers that nobody's ever seen before.
Dr. Oz, cutting drug prices by 400%, anything over 100%, wouldn't that effectively make them free? Is that a realistic goal from the president?
The president does the calculation by saying, okay, if a drug was $100 and you reduce it to $50, it's 100% cheaper because you're taking $50 off and living with only $50. So the amount you took off the price is equal to the amount that's left. They're equal, so it's 100%.
But he said 1,500%. In one of those, he said 1,500%.
Well, if you take a drug that is $200 or $240 like we did last week and you reduce it to $10, those are the numbers you're talking about. That stated, the bigger question we should be asking ourselves is why didn't we do this earlier? Kristen, you and I have known each other for a long time. This has not been a secret that we pay 3 times more for the exact same pill made in the same factory, even if it's made in America, than that same product sells for overseas. And when the president learned about this a while back, he got upset and he started making a big deal about it, both in the first term and this time around. He said, I'm not going to be stopped. I'm going to make sure everyone understands that it is not America's responsibility to carry the entire burden for innovating solutions to America's health crises. The entire world benefits from those crises. And so, as you know, we have achieved great success by dropping the drugs that are sold by a leading U.S. company, Pfizer, a leading European company, AstraZeneca. Last week, we reduced prices for fertility drugs by literally $242 to $10.
Dr. Oz, none of that's binding, though. Does that need to be codified by Congress? Does that need to be put into law by Congress? Those lower prices by Pfizer?
Kristen, we have contracts, signed contracts from the manufacturers, as Secretary of Commerce Lutnick and Secretary of Health and Human Services Kennedy. These are signed documents. They hold water. And we have many other deals in the pipeline, same construct. We are pledging not to tariff these endeavors if these companies bring onshore their drug manufacturing, so bring their work to America so American workers get jobs and revenue from those facilities flow to the American tax base. We're going to make sure that all Medicaid patients get most favored nation drug pricing so governors don't have as much of a burden to pay for. We're going to make sure that all new products released in this country are at that most favored nation pricing, and we're getting better pricing even for Medicare drugs. So across the board, we're delivering on something that no one thought was even possible because the president knows how to negotiate. The first step in negotiating is to ask.
Dr. Oz, thank you so much. I have many more questions, but we're going to have you back, and I'll ask you all of them. Thank you so much for joining me. Really appreciate it.
Take care, Kristen.
We thank you for watching. And remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.